don't want to be in hospital. I'm living here on my own, but at least it's mine. Why do you want to be in hospital, eating hospital food?
I've called them out emergency, which I don't like doing, and rushed him into hospital. I sat there for 7.5 hours with my husband. I don't want him in hospital. They think I do, I don't. But when it gets serious, I have to.
Both Mr. Clark and the denizens are taking part in one of several initiatives around the UK to try to reduce unnecessary hospital admissions, particularly among older people. The London Borough of Wandsworth has developed a multidisciplinary model called the community ward. This has shifted access to services found in a hospital ward into the community. It's an idea originally developed in Croydon, South London.
In Croydon, the intervention was led by community matrons. They did have doctor support, both general practitioner and geriatrician support, and they had social workers involved in that multidisciplinary team platform. And there were some really good things that came out of that. One of the things that was identified from this pilot, though, was that there was still difficulties sometimes with accessing general practitioners. We decided in Wandsworth to employ the GPs specifically by community services, so that they are working full-time, they have their full-time focus on assisting community services across the board to better able to manage patients at home.
Wandsworth has an unusual demographic with a large and mobile young population and a relatively small group of over 65s. Within this group, there's a larger than average proportion aged over 80. It is these and vulnerable over 65s for whom staying at home is the biggest challenge.
All over the country, admissions into hospital, into secondary care are increasing beyond the capacity to be able to afford. No patient wants to go into hospital if they can possibly avoid it. We would all prefer to be able to have our healthcare managed at home if it's safe and if it's possible.
This wasn't something GPs could achieve alone. It had to be a joint initiative with social services in order to offer people the necessary integrated support in their homes throughout the borough.
The borough is divided into 4 polysystems, which are broadly similar in their characteristics as far as the number of population and the demographic requirements of those areas. Each polysystem has its own community ward, which has a GP at the heart of it, also surrounded by a multidisciplinary group of professionals, both health and social care. So we have a social worker in each community ward.
In addition, the community wards offered the services of an advanced nurse practitioner to respond to emergency or acute calls, a pharmacist and a community matron. So how does a patient like Mr. Clark get admitted to the community ward?
They can be referred from anyone throughout the health or social services. So a GP, a hospital doctor or an A&E doctor, social services of course, ambulance service, the voluntary sector, because we work closely with Age UK as well. That if they identify that this patient looks like they're going to be in need, looks like there's a likelihood of them having to go to hospital for whatever reason, they can contact us and we will have a look at the case and visit the patient and see if there's anything that we can do to help.
It is people that have a number of comorbidities, significant health needs, who have a history of being hospital readmissions, and almost this revolving door which we're trying to stop.
It's a number of techniques, a number of technical things that can be used to help that. Telehealth concept, where people can have their blood pressure and their pulse and their weight and other things, other medical aspects measured, which can then be monitored in a central area in the community ward office, can really help.
With this equipment, I know I'm monitoring myself every day, right, and I can see what I am doing.
Good morning. It is now time to record your vital signs. Please step on the scale.
It's improved my health, my sense of isolation. Yeah, well, I know somebody's going to be around at some time or another, and I expect if I didn't ring in for a couple of days, they'd want to know why.
Mr. Clark's daily readings are received at Westmoor Community Clinic, home to the West Wandsworth Community Ward. Here, the multidisciplinary team conducts a weekly whiteboard meeting. This virtual version of a hospital ward tour monitors all the ward's users, responding to their immediate needs.
The next door neighbour just phoned to inform that she's not feeling very well, Should you like to speak to you, Tom?
People are really happy to have home visits, so somebody give them a bit more time. You know, just we have time constraints as a GP in the surgery. It's only about 10 minutes per consultation. So at home, you actually do get to see them, give them more time. You can see the environment they live in. So some people can look after themselves, they have family. Other people are completely alone. So when you come into a home, you can actually assess a lot more than just a medical condition.
Having observed an individual's domestic conditions, the ward's medical team is immediately able to call upon Shirley Ellis, the community ward social worker.
And they refer back to me and say, Shirley, we feel that this person could really benefit from an input of a package of care because their social needs are such that warrant an assessment, and I will go out and do the holistic assessment. Being a community worker, you do spend a lot of time, especially when you get your new referrals in, you go and do your assessment, at least 60% of the time out visiting, and going back and making sure things are working and people are being cared for and getting the service.
Shirley's first visit today is to Mr. Clark, to see how he's doing and making sure he's getting the services he needs.
I must have known.
Good morning, Mr. Clark. How are you? How have you actually found the benefits of actually being on the community ward?
Completely and utterly brilliant, because it stopped me being in hospital.
Right.
Prior to that, I was going 6 weeks, maybe 8 weeks, and then I was in hospital for 10 days.
So just regarding your, like I said, your appearance, I've noticed a change since you've actually been with the community ward as well. You've reduced in your weight as well.
Yeah.
And how have you been managing that?
Well, the thing is, I've not only lost weight, I'm maintaining the lost weight. I can weigh myself every day. If it's going too much, then I cut down the water, or I'm not supposed to, naughty man, but I do stop eating a bit, you know.
I know that we spoke about your mobility and wanted to actually help you in actually being more mobile. How's that going at the moment?
Well, my mobility's not good. I've applied to see about getting a wheelchair. I mean, the wheelchair that I've made the inquiry about would be able to manage that.
Right.
It's designed for going up and down curbs.
Well, the OT will actually do the assessment for any adaptation outside to help, like you said, getting up the slope and to safely get you in and out of your property. But like you said, they're doing the assessment, so hopefully we can have a good outcome and they can get you the appropriate equipment so you can actually get out and about.
The community ward is also there for the carers. Shirley's next call is with the Denizens. Mary Denizen is the full-time carer for husband Colin, who after a history of heart attacks, emphysema and stroke, now suffers from dementia.
How are you doing?
Not too bad.
Okay.
Right.
I heard you were whisked away to hospital this morning.
Morning, yes.
How are you doing now?
Better.
Yeah? You weren't in there too long, were you?
No.
Did they just run a few tests with you?
Then they started looking and talking to each other, and then that was it.
Okay. How are you coping, Mrs. D?
Oh, I'm coping fine, but I do need some respite, as you mentioned, for me.
Right. Well, that's something that we can look at, incorporate into your current package of care.
Well, I would like a week somewhere, you know, complete away. Okay. That's what I would like.
Right.
So that I can rest my mind and my body.
Okay. Have you thought any more about maybe having a sit-in service like Crossroads that we can actually use to give you a bit of a break as well?
No, I didn't really. I mean, we did speak about it, but I hadn't really thought about it. I thought it could be quite complicated in a way, because by the time they got here and sat for 2 hours, I'd just about get to Kingston and back.
You can negotiate the time, so it is really to suit around how many hours you want.
Yes.
So if it's for more than 2 hours, we can negotiate that. So it's really to help you.
So, you know, there is a lot to look at, and we need help, more help, because it's hard work. I mean, I used to be 11.5 stone. I'm 7.5 stone now. So it just tells you what it takes from you.
Less than a year in, the impact of the community ward is still being assessed, but early anecdotal evidence is indicating a change in hospital admission patterns.
I go to the Queen Mary's ward rounds on a Monday morning together with the geriatrician, Dr. Harold Lowe, and he's told us, for example, that in Kingston in the last few months there's been a 20% decrease of admissions, acute admissions.
These patients that we are working with are having better outcomes in terms of reduced admissions, but whether that in an overall sense, in a global sense across the borough is actually going to prove to be economically viable, we're still uncertain yet. More research still needs to be done on that.
Probably the most fundamental key to all of this is actually about communication and about respect. So it's about health professionals and social care professionals and the voluntary community sector and people who work in cultural services and people who work in other statutory agencies, all respecting the role that they play and the role that others play in overall delivery of the health and wellbeing agenda. And I think that's where I want to see the community ward, which I think is a fantastic model for a particular cohort of people, being expanded, or being the principles of it being expanded to address the needs of a much wider population, which we're all going to have to service in the future.
My honest opinion is that every person over 65 who is a little unwell should have this sort of thing fitted. And it would save the nurses. They don't have to come every day. They're getting a result from me, so they know that what I'm doing is either right or wrong, and it must be the best thing to do. Keep the people out of hospital. Keep the beds for the people that really need it.
I would give the community ward about 80%. I think they're wonderful, really. They have been for us anyway. I would give them 80 out of 100. And probably 85 when I get my respite.